Dumela motswana wethu. Welcome to Boswa. My name is Thaloso Lekopanye, your host. Today, we are at Karong Clinic. We will be talking about breast cancer. Joining me is Dr. Khalil, who is a general surgeon.
Good afternoon. My name is Dr. George Khalil. I'm a general surgeon with experience in oncosurgery or surgery for cancer cases. My practice is based at Karong Clinics in the city of Gaborone, and my clinic name is Oncosurgery, after the name of my services. And my services usually providing general surgical consultations and surgical consultations for cancer cases, most specifically for breast cancer, colon cancer, skin cancer.
Dr. Khalil, can you kindly introduce your clinic?
Okay, good afternoon. My name is Dr. George Khalil, or surgery for cancer cases, and my practice is based at Karong in the city of Gaborone. Clinic name is Oncosurgery of my services, and my services usually provide general surgical consultations and surgical consultations for cancer cases, most specifically for breast cancer, colon cancer, skin cancer, and among my services also doing some scopes and some other tests for early detection of general cancer.
What are the symptoms and causes of breast cancer?
All right.
Ask that again. You ask the same question again. No, repeat again. Okay, exactly. Stand up. Stand up. Sharp. And what's your thing again? All right, sharp.
I said cut narrow.
Don't cut.
Sure. Second take.
Okay, second take. Not from the top, huh? Kebarolen Tapuzwa, please remind the ladies to lower their voices at reception. And rolling. Action.
What are the symptoms and causes of breast cancer?
All right, symptoms and causes. I think if we start with causes, there is some causes related to hereditary factors or genetic predisposing, like you see some cases runs in families. Others are not related to hereditary reasons. And for causes, we can talk about risk factors. If it's present, there is a high risk to develop breast. Like some of them, unfortunately, we can't change them. Like being a lady, female, not male, and age starting from above age 50 or 55, it can increase the risk. Some other factors like run in family, like what I said, some problems happening in mechanism of defense against cancer, and it carried on genes from generation to generation, so this is why it runs in family. And other factors is like some which we can change it, but others also it's a bit difficult to change, like that first childbirth, if it's late, and maybe early menarche, which the lady or the girl start to have period, and late menopause. This is more exposure to the hormones. And again, on another way, exposure to hormones can be by hormonal replacement treatment in menopausal ladies, or maybe some family planning, which also can contribute. lack of breastfeeding, but it's not very strong. Other factors which can be corrected, like to get appropriate weight and treat obesity, and to avoid alcohol in drinks and tobacco, smoking, and also lifestyle, healthy lifestyle, exercises. It also decreases the risk, and healthy food. So all these decreasing the risk. Okay, so this is a risk factor contributing to breast. The symptoms, going to your question, symptoms is what the patient come or have concerning him to come to think about cancer. So I would say some of the cases they don't have any symptoms. We call it asymptomatic. So we discover cancer breast, but very rare. When we check the mammogram or the X-ray of the breast, when some ladies they go for routine screening or testing, and then we can see some alarming signs in the mammogram.
Camera 1 rolling.
Sound. Good. Camera 2.
Rolling.
Action.
Dr. Khalil, can you kindly introduce yourself, your services, and the name of your clinic?
Okay, good afternoon. My name is Dr. George Khalil. I'm a general surgeon with experience in oncosurgery or surgery for cancer cases, and I am practiced. My practice is based at Karong Clinics in the city of Gaborone, and my clinic name is Oncosurgery, after the name of my services. And my services usually providing general surgical consultations and surgical consultations for cancer cases, most specifically for breast cancer, colon cancer, skin cancer, and among my services also doing some scopes and some other tests for early detection of general cancer.
What are the symptoms and causes of breast cancer?
All right.
You ask that again. You ask the same question again. No, move it again. Exactly. Almost another. Stand up. Sure. And what's your thing again?
What are they?
Sure.
I said cut.
Don't cut.
Sure. Second take.
Okay, second take. Not from the top, huh? Camera rolling. Takuzwa, please remind the ladies to lower their voices at the reception. And rolling.
Some which we can change it, but others also it's a bit difficult to change, like the
Welcome back to Boswa. We are continuing on breast cancer issues. Dr. Khalil, I've been wondering if breast cancer have treatment, and if yes, what are those treatments? Are the treatment having the side effects?
This is a very good question, and the answer is very promising. Like if we go a little bit to the history in the past 30-40 years and comparing with cure rate and or maybe what we call it survival rate of cancer breast, we will find that death rate has decreased by 40% in the past 30 to 40 years. So this means there is a big improvement in treatment, saving more lives. And of course, reason for this is advances in early detection and which it is achieved by screening before having any symptoms, and also the improvement in the modality of treatment. So there are many different modalities of treatment, and as I said first earlier, it depends on the stage of the disease. But namely, to summarize or to start with, is treatment of cancer breast primarily is surgery. And in surgery also there is different options. Like, just to mention some of them, like lumpectomy, which is removal of the breast lump alone, and quadrantectomy, removal of big part of the breast. Total mastectomy is removal of the breast with total axillary lymph node dissection, is removal of the lymph nodes under the armpit. These are all the surgical modalities for the disease which still can be amenable to be resected or removed. And of course, to choose which one, it depends on some guidelines and some stages of the disease, which we mentioned earlier. Apart of surgery, there is other treatment for breast cancer, which can be done either before the operation or during or after the operation. Some of them we can mention it, like chemotherapy, which is treatment by medication, which can be taken by mouth or IV in outpatient setting. And other treatment, we can mention hormonal treatment. It's medicine which can suppress some hormones, which they are influence the breast cancer, and also it can prevent recurrence after surgery. And also it can be used in some setups, like as a prevention for having cancer in very high risk patients. And then there's other immune therapy, and there's other newer medicine which is called targeted medication. So all these different modalities of treatment, and with the help of advancement of these medications and the researches, as I mentioned earlier, that this has come down 40% in the past 30 years. And also nowadays there is advantage in modern chemotherapy, which has very minimum side effect, because you mentioned side effect, which can be like a fear to many of the patients when they hear chemotherapy, because this is what I face. Some people, they are afraid when they hear the word chemotherapy. But I would like encourage people, there is big advances in chemotherapy with very minimum side effect. And you see, to just mention few of them, like fatigue, tiredness, some anemia, or some of newer medicines, they can have gastrointestinal problems like diarrhea, constipations, which nowadays it's very manageable. Yeah.
What is the survival rate to this treatment?
So survival rate, as I mentioned, it links with the stage of the disease. So if the stage is still localized to the breast, sometimes we measure by 5-year survival or 10-year survival. For 5-year survival, in first stages, which is localized only to the breast, it can reach up to 98%. So 98, almost everyone will live for 5 years or more, or less. And 10 years, it can be above 70% or 80%. This is the early stages. Intermediate stage, which is not localized but regional, it's still in this area of the body, not far. Yeah, it can reach to 80% still, 5 years survival, 10 years is a bit less. And here you can see the difference between the discovering of the disease early, which is early stages, so it gives almost very near to 100% cure and survival in 5 years, 80% or more in 10 years, and when the disease is discovered very late, so survival rate is not promising actually.
How can we prevent this breast cancer?
Okay, so I would like maybe before I answer how to prevent the breast cancer, how to discover it early, because now we know that there is a big difference in early discovery, early stage and late stage. So to discover breast cancer early, it has some like screening programs, and in this screening program there is main tools is mammogram, ultrasound scan, and also in some cases or rare cases MRI, self breast examination. More rare cases, some prophylactic measurements with very high and very risky patients. Like sometimes we can give hormonal treatment, we call it medical prevention, and sometimes we can perform what is called prophylactic mastectomies, like maybe removal both breast before even breast cancer to happen. But of course it has limitation in very high risk patients, so when they have done some genetic coding, and also they have a strong family history, like sister and or mother, or maybe both, or maybe more than 2 people in her family has or had or suffered or died from breast cancer. So in these cases we can do this to early detection. Prevention, coming back to your questions, you remember we said high risk factors, some things we can't change. So we can't prevent. And being female, for example, age 50 or 70, we can't change this. But in the changeable high risk factors, we have to avoid them, like change lifestyle, reduce weight, stop smoking, away from alcohol, and healthy food, exercise, self-breast examination, screening. All these can be a method of prevention.
Yes, I would like you to do a little bit of demonstration of self-test. But before that, how are the people who are already having cancer, how can they take care of themselves, those who already have cancer?
They have cancer already, yes. So they are a cancer patient or it's cancer survival?
Yes.
Okay, of course, first they have to be treated, right? And they have to follow the standard treatment modalities. They have to follow their doctors' advice, and they have not to be afraid of treatment because of side effects. And also, you see, some people, they have to be encouraged by to contact some breast cancer survival group, so they can be encouraged by their experiences. And for treatment for cancer breast, it's like any disease, is a holistic approach, treating the patient, not the disease. So it has to involve a lot of other team doctors. So it's not only ours, it's not the surgeons, because in treating cancer breast, the patient, they have to have surgeons, they have to have oncologists, they have to have radiologists, dietitian, psychology and psychiatric support, family support. So it's a big team to treatment. But again, cancer survival patient, they have to look their general health apart from breast, you see, to do annual checkups, to check their whole body life, and also not only physical but mentally also. And they have also to have a healthy lifestyle. They have to follow the follow-up regime by their doctors, because after treatment it's not like it's one-time treatment. As I said, you see, there is sometimes can happen like coming back of the disease or recurrence. So it has to be followed up according to the doctor's advice.
You can really show us the demonstration.
Okay, so demonstration of self-breast exam, there's different ways to do it, even while the lady is standing in front of a mirror or maybe lying on her back. The only thing, not to miss any part of the breast, and also to examine under armpit. So in any manner she likes, like in a circular manner, starting from one part going to the other part, not forgetting the middle part, and then by examining by the other hand she can examine the folds of the armpit under the muscle here, and before the muscle at the back, in the middle, in here near to the arm. And it shouldn't be too frequent, and it's not very strong that it is one of the like screening method, but screening I mentioned before is more important. Mammogram, ultrasound, MRI, genotype for high-risk people. Even though screening can happen in younger age group, of course it depends on the high risk and the history of the patient, the history of the family, or like previous surgery, previous cancer, family history. All these can sometimes also screening very rarely can start at the age of 25 years of age. Thank you.
Dr. Khalil has shown us the demonstration of self-test of breast cancer. Now we'll be going out to the community to find out what they do understand about breast cancer. Catch up with us after this break.
So ne ke rotloetsa batswana gore ba rotloetse basadi ba bone a le gore ke motho a rotloetse mokapelo wa gore a kgone go itšheka kankere ya bomme. So gore itemola rona le kankere ya bomme o tla lemoga ka ise ke se itseng ke itse gore o kgona go nna le seso mo lebeleng, dithompola mo lebeleng, ka gore le nna mosadi wa me ke kgona go mo tšheka ke mo rotloetse gore le ena ye go itšheka.
Ke na le my cousin o na lwala breast cancer a tsena mo treatmenteng ba letsa ba kgaotse lebele ba bona o ka re ano e tsamaya le mmele thata a tsena mo treatment gante ke ya go te cancer ya madi le pele a simolotsa o dule ditumpunyana la mo lebele se ga sepe ka ntle go mong o to mo tsela botshelo go tshela tsaka ka ne ke rotloetsa batswana banana bagolo simane ngwana gore hela utwa sa inewe ya tumpunyana mo lebeleng.
I believe there's a significant amount of education, enough, not really. I think there could be more awareness, more activations and more information put out there for breast cancer awareness. What I do know of is ways to look for breast cancer among yourself. Lifting your hand and looking for a clump around your bust area and reporting it to the medical facilities, whether you've discovered something or not. That's as far as I know.
To someone who's just been diagnosed with breast cancer, this is not the end of life. There's still hope to beat it. The fact that people are coming out with these awarenesses shows that they know that the disease is there, the illness is there, but it doesn't mean that that's the end of the world. We can still beat breast cancer, one woman at a time. The fact that you have it does not mean that you are careless or you have bad luck, but it just means that you have contracted something that you can still fight at the end of the day. So don't lose hope. You have it in you to fight this, and together we can.
Welcome back to Boswa. We are continuing back on breast cancer issues. Dr. Khalil.
Try to discover the disease early because it affects the outcome of the disease. And try also to follow advice and the doctor's opinion. And sometimes people also, they can come in their mind some fears or some false beliefs, which makes them not like doing the right things. So it can lead to complication or to delay the treatment, and then it can lead to late treatment and bad prognosis or bad outcome. Yeah, and I need people to know that screening is important, early detection is crucial for treatment, and follow up the doctor's instructions is very important. I think this is the sum up of what I want.
Thank you so much.
Yes.
Thank you so much for giving us, Dr. Khalil.
Good. Thank you so much for giving me this time also to talk, because this important problem not only on health but also in the environment and in the community as well, because it affects people and also it affects a lot of aspects of people's life. Thank you.
Thank you so much.
You are welcome. Thank you.